Good evening, friends. I'm very happy to be with you and share some of what I call really Man Ki Baat. During this pandemic, there have been so many webinars and so many conflicting advices, both in terms of managing COVID and managing diabetes. So I'm going to talk about my own experience, my own wisdom, experience, common sense, and give you a general advice as how you manage diabetes in pandemic. What has happened? The regulatory bodies have given us multiple advices. Many of them are conflicting and contradictory. WHO says something, and WHO that is doing a fantastic job. Huh? Every month they have different ideas. It is not that they have said something and they are sticking to that. So WHO, ICMR, Bombay Municipal Corporation, All India Institute of Medical Sciences, they're all good people. You see, All India Institute of Medical Sciences, Guleria and all those people are very smart doctors. There's no doubt they have vast experience. I'm not saying they are talking rubbish, but sum total of all the advices confuses doctors, confuses population, confuses patients who suffer from COVID. So I thought that let us talk on a very simple platform based on fundamental of medicine and fundamental of disease process. You all know that COVID or Corona is a virus disease. Like virus disease is nothing new to us. India, we have had multiple viruses. In fact, we were smart. Our country eradicated smallpox. It eradicated polio. So, in viral disease, we are champions. But the point is, this has come up very abruptly. The information about this disease is only for last 3 to 4 years. And as the science is getting smarter, the virus is getting super smarter. Virus has to just change the coat. The virus keeps on changing its clothes. And therefore, the immunological profiles keep on varying. So first phase, second wave, and now they are expecting the third wave. But what has remained a constant advice? There are 4 fundamental advices. I'm not talking about drugs. I'm not talking about anything else. There is no doubt that vaccination helps. People who have received 2 shots of vaccines have got almost 70% protection. But ultimately, what protects is your own body's immunity. So now, how do you increase your immunity? Dr. Raja and me, we are talking about immune-mediated diseases and immune-related damage to body cell for last 35 years. Dr. Raja said that, look here, my friends, diabetes and coronary artery disease are immune-mediated disorders, immune inflammatory disorders. Immunological problems produce inflammation. Pro-inflammatory cytokines, interleukin-1, interleukin-6, tumor necrosis factor, alpha, and multiple other cytokines come into the picture due to the immunological problem. Now here, what really helps a person is developing his own immunity. And immunity is developed by 3 things, basic things: excellent nutrition, adequate sleep for 7 to 8 hours, physical exercise, and manashanti. Now, to particularly fight this disease, your weapon is excellent lungs. The lung must be fortified by yogas, pranayam, sukshma pranayam, multiple asanas to develop your basis of lung. That's why I always tell people that you lie down in your tummy, because when you sit and stand, your anterior portion of the lung, which is almost 1/3 of the capacity of the pulmonary vasculature, most of the aeration takes place in the bases, and those remain collapsed. When you lie down on your tummy, that portion of the lung which is collapsed expands, and you do what is known as sukshma pranayam, deep breathing exercises in alternate position, in supine position, in prone position, and aerate your lungs. That is a very big weapon in your hand. The second thing is mask. You must know that mask is a real protection. Mask has protected us from viral disease, yes, but do you know one thing? That because we are wearing masks, there are other nasal transmitted, nasopharyngeal transmitted viral infection epidemics are also on the lower side now. Flu, influenza, H1N1. So mask has a terrific protection if you wear it properly, not as an ornament in the neck. Some people wear the mask only as a show. Mask must cover the nasal passage completely, fully up to the bridge of the nose. The mask should come, and the entire mouth should be snugly fitted with the mask. Frequent washing hands. Frequent washing hands with a proper foam. Only applying soap is not adequate. The foam is the enemy of virus, not the soap. Rinse your hands at least 3 to 4 times in a day when you come from outside, or even if you are at home. Avoid shaking hands with people. Our old Hindu culture saying namaskar has a lot of protection rather than shaking hands and hugging each other. That's not our culture. And the most important is take adequate rest. Don't get frightened. COVID has killed more number of people because of phobia. People are afraid. Bapre. And quarantine does not mean you ostracize somebody. वाईट टाकण्याचं काम करायचं नाही. You must have sympathy. You must give support. You should not dislocate them completely and put them in a room. So attitude towards the COVID patient also must change, more matured. Then of course, all vaccines are good. I don't want to go into controversy. I don't want to go into controversy of booster dose. Booster dose, some people say that it will be useful. Some people say you have to do spike protein antibodies. In my opinion, doing spike protein antibodies is of no use, because many times, even after taking 2 shots of vaccines, we have not seen some patients without any protective spike protein antibody. So don't go by that too much. Vaccines you must take with a proper gap, whatever the government has asked. About 46 days is what is recommended between the 2 vaccines which you should take. Then comes the priority of treating chronic ailments, which make you more vulnerable to COVID, and one of them is diabetes. And the blood sugar should be optimum, not too low, not too high, and HbA1c should be around 7. Fasting blood sugar between 120 to 140, post lunch less than 180. And there is a terminology known as TIR, time in range. The blood sugar should be in a range of 120 to 180, 80% of the time when you use this CGMS. You see this machine? This is what is CGMS, and this is a sensor, and this is the reader. You read it, you can read it 50 times a day, and it tells you a reading. Now, this time in range is more accurate than glycosylated hemoglobin. And if your time in range is around 80%, then you're well protected against all the problems of diabetes. Diabetes complications worsen, particularly vascular complications and immune inflammatory complications. First time diabetes detected in COVID due to pancreatitis. The beta cells are extremely vulnerable to this virus, and the cytokines also play havoc. So a person was not known to be a diabetic is found to be diabetic, and you have to treat such diabetes aggressively. Other comorbidities such as hypertension, hyperlipidemias, early nephropathy, reduced EGFR, all need to be addressed. Insulin is the drug of choice. In my opinion, oral hypoglycemic agents can be continued, but I would not like to use metformin. I would rather use insulin 3 times a day to optimize the blood glucose. Then early antibiotics in certain cases of pulmonary infiltrates. If the CT scan shows pulmonary infiltrates, then you need desmavir and other drugs, antibiotics like monosef or even penicillin group, but they are not very effective. Doxycycline, levofloxacillin, these are very good. I like to avoid aminoglycosides because of possible reduced EGFR. But a good cover of antibiotic, proper dosage, and in case the CT findings is a cycle threshold, it's a number of virus taken out in the first shot. If the CT values exceed certain number of figures, then you have to be very aggressive. This cycle threshold also decides the viral load. Higher the viral load, higher should be the vigilance. Low viral load does not mean you can just laugh it off. It's not true, because sometimes the viral load keeps on changing. Second thing I always like to say, RT-PCR test that you do, you should delay it for about 8 days. First 5 days of infection, sometimes the RT-PCR is negative. So if the patient has got mild symptoms like sardi, khokla, little cough, you don't do it on the day 1. You wait for 5 days. 6 day to 7 day to 8 day, the chances of RT-PCR positive are high. Once the RT-PCR is positive, you have to go to a proper center. Mild to moderate patients can be looked after at home, but patients with reduction in oxygen saturation on 5 minutes walk test, less than 93, tachycardia, they need hospitalization, and they need low flow oxygen therapy. Unfortunately, the oxygen went into short supply, so we started auditing oxygen. A lot of people were given unnecessarily large doses of oxygen, not required. So oxygen supply should be regulated under proper supervision. And really, if the person is deprived of oxygenation and has many other problems secondary to hypoxia, then he needs a proper flow oxygen, 6 to 7 liters. Otherwise, they don't need a very high flow oxygen supply. Very few people may need a ventilator. Very few people. Ventilation should be avoided as much as possible unless the patient is getting tachypneic and having developed multiple VPCs, cardiac events, then you put the patient on ventilator. Do not delay it. So all these judicious judgments are taken by our COVID pundits. Our hospital has a huge number of smart COVID related doctors. The intensivists are really well trained. And all the hospitals who run the COVID wards and ICUs, they have really good, competent people. And some of them are really well trained and they have a sixth sense which patient to put on the ventilator, which patient not, and they normally are not wrong. So this is, in short, the treatment of diabetes and pandemic. Please remember one thing, that the pandemic has become worse because the patients with COVID, with altered immunity, are susceptible to some disease such as, suddenly we have seen Vivax malaria has come up, dengue has come up, chikungunya has come up. Now this chikungunya, we did not see many cases recently. Again, they have come up. Vivax, I'm seeing after almost 3 years, and the patients with Vivax and COVID, there is a very high risk of mortality. The platelet count drops, and there are many issues that we need to look after. So comorbid infections are also very important to diagnose and treat. It's not a big deal. Many people survive. Our success rate of Raj Hospital, I think we have treated more than 3,000 patients so far. Mortality rate is even 0.1%. And that is a similar situation in other hospitals which are treating COVID. So we don't see much of mortality, but the morbidity is quite a lot, and quarantine particularly has a lot of financial setback. But remember one saying, Sir Salamat to Pagdi Pachas. You must survive this. Then there is a lot of time left for you to earn back the same money that you lost. So friends, this is the pearls of the wisdom of Dr. Bhoraskar. Thank you very much for giving me a very patient hearing. Thank you.